So welcome to MedBeautyLA's first ever webinar. Today, we are going to teach you all about what's new in non-surgical rejuvenation. So I am very excited to introduce you. We have two amazing speakers. Dr. Lori Aliksanian is the owner and medical director of MedBeautyLA. She is a board certified wound specialist physician, which gives her a very unique perspective to all these aesthetic treatments. Her practice is very heavily focused on medical grade skincare, injectables, lasers, and all types of facial and body rejuvenation. She also lives in downtown LA, right where our practice is. And she is an amazing asset. She opened up MedBeautyLA in 2019, just before the pandemic hit. And so we are really excited to hear from her today. Second, today we have Dolly, our nurse practitioner, Dolly, who is actually soon to be a full nurse practitioner. She's had 4 years of experience in aesthetic nursing. She has her master's in nursing, and she also focuses in nutritional science, physiology, and biology. So Dolly brings a lot to the table and does everything from PRP to lasers and skincare and everything in between. So between the two of them, you are in great hands. So let's get going. I hand it over to you, Dr. Aliksanian.
Hi, thank you. So today we're going to talk about trends we're seeing for 2022, a little bit based on what we've been seeing through 2021 and what we anticipate will become even more popular next year. So 2022 trends are pointing towards fresh faces, a lot less makeup, a lot better focus on glowing skin, healthy skin. And we're seeing the use of our injectables become combined with our really deep medical grade skincare, resurfacing treatments, and lasers. So next slide. So our most common patient concerns after quarantine have been a little bit more focused on skin. So dark spots, things that they were able to kind of ignore when they were more at home. They're starting to pay a lot more attention to these little fine lines and imperfections in the skin. So we have smile lines, marionette lines. These are the nasolabial lines, and then also lower face. These are the first signs of aging. And so people are starting to realize that these are becoming bothersome. Sagging in the lower face and jaw, under chin fat. These are concerns that clients had pre-COVID. And then when we were in the middle of 2020, I think people were a little bit less focused, a lot more focused on the upper face and the eyes. But now that we are, wearing less masks and able to safely interact a little bit more, there's a lot more concern for overall facial rejuvenation and tightening. And then the last thing would be necklines. We're getting a lot of people with concerns for tech neck, horizontal necklines, vertical necklines, and just overall neck tightening and aging. So clients will tell us that the signs of aging that they have been paying attention to by being on multiple Zoom calls over the past, year have been focusing on, irregularities, asymmetries in the face, but also a lot more focused skin imperfections. So the first signs of aging, really wrinkling, sagging, texture change, loss of elasticity, all of these things will come into play with the skincare and also loss of volume in the face. So what can be done? That's what everybody comes in asking us, what do I need on my face, or which of these concerns do you think is the most important? What should be targeted to make me look fresher, maybe younger, better rested, and still continue keeping your own, character and expression. So we like a combination approach. So the goal in 2022 is to minimize downtime, minimize trips to the office, and maximize outcomes. So we like a combination approach to do at least 2 treatments at a time every time we're in office. We want to do either a really deep chemical peel or a microneedling resurfacing the skin, but also at the same time at the end of that appointment doing the injectable, so that you only have to be down for 2-3 days one time instead of multiple times in a row. And when you are done with your downtime from your chemical peel, your Botox has kicked in, your fillers have, completed all their inflammatory phase, and you're totally rejuvenated. And we're finding that, with the data showing now that lasers can be also safely combined with injectables, can be safely combined with a lot of other skin treatments. We can do multiple things at the same time. So we're going to go through some of our patient photos and some of the outcomes. This patient was a combination approach of multiple modalities. So patient's concern was some laxity of the jawline, some fullness, and some, overall facial sagging and loss of volume in the cheeks. And so we did this over a few different treatments, but combined, so all therapy to overall tighten the face and give sort of a non-surgical facelift. It does some deep ultrasound stimulation that tightens the skin. It's a really great adjunct treatment, can be used at the same time as injectables. So at the end of the appointment, we had already numbed the patient's face, so we were able to take advantage of that and also provide dermal fillers on the same visit. And then on separate visits, we did some treatments of Capillaries. So we were able to tighten the jawline and give that really nice sharp angle and overall facial volume correction. Under eye area looks better. The entire jawline looks a lot more symmetric, smoother, and the face just looks younger and fresher. This patient, we did a few multiple treatments of microneedling to help with some dark spots and fine lines. And also microneedling does help with collagen rejuvenation, which does tighten and improve the skin. This patient didn't want any Botox or fillers, was very conservative about injectables, but we were able to do another treatment of all therapy to help with raising the brow. And it helped with a subtle improvement in the brow contour, and then the therapy helped also tighten around the eye area. The microneedling helped resurface the entire skin. The next patient is just an example of how quickly you can see results. So this patient had a few syringes of dermal filler to the under eye and malar mid-face complex and some preventative Botox. Obviously the Botox hasn't kicked in right away, but the filler, we can see that result right away. And you can already see on the left side of the photo how much younger and fuller and well-rested the face looks. This next patient is an example of a neck treatment. And there are multiple different ways that we can approach treating the neck. This patient is still in the midst of a full treatment program, but already has quite a bit of improvement. So we did some neck Botox to help relax the horizontal lines. And she started using a daily serum peptide cream. The peptide cream helps build collagen. And so if you look at the skin, it actually looks better, but it's actually because it's building collagen. It actually is thicker. And so the Botox is relaxing it, but the skin is actually fuller. And all of these treatments are really to build collagen and help thicken the dermis to give us better structural support so that we're not just temporarily correcting things with Botox and fillers. We are also improving what's holding everything together on our face. And then our next patient had multiple fillers done at the same time on one visit. So this is, to show an example of what can be done with just one period of downtime. So she had overall facial rejuvenation with just dermal fillers. We did her nasolabial folds, a little bit in the chin, but also definitely the cheek and under eye area where she was looking a little bit hollow, and the temples. And overall, she felt like, she was really happy with this result. She felt like she looked, 5 years younger, a lot better rested. Her face just had a little bit more support. And she's been using medical grade skincare. So her skin, actually, the tone is really nice and fresh and even. And you can see that, you need both of those because she had the good skin tone, but with the volume loss, she still wasn't looking as young as she could or as fresh as she could. The fillers helped with that. And so really combination treatments are what we see as the trend for 2022. So we want patients to be able to come in for, an hour and a half treatment and be able to have multiple things addressed at the same time. You want your dark spots, your fine lines addressed, some of your, broken capillaries and skin abnormalities that you're, of concern that are normal things that happen with aging, we can address all of that texture and tone at the same time as we're doing volume correction. So all in one visit is really where we're heading in 2022. So we're going to look at a few examples of why it is so important to focus on the skin. No matter what we do for anti-aging, if we're not taking care of the skin, which is the first thing that people see when they look at your face, you're still going to have a giveaway of your age. You're going to look, not as refreshed. You're going to look a little bit older than needed, right? And so this patient in this slide has acne scarring. She's only in her 30s, but this acne scarring, as well as the post-inflammatory hyperpigmentation, so that's the darkness that we kind of see between her acne scars. This is all because of picking and flares of acne over the years. This is making her skin look much older than her age of early 30s. So with multiple treatments of laser and skin resurfacing, we're going to be able to improve this patient so that she has the skin that goes with her age. And then this next patient is an example of somebody who has a lot of photo damage. So, the main reasons that we get a lot of aging concerns all at once in our, late 20s, early 30s, start every year gets worse, collagen volume loss. But one of the main reasons is obviously UV damage. So the areas that are sun exposed, which is the forehead, the upper face, these are the areas that have the most texture change and also the most tone change, as well as the wrinkling and loss of volume there. So this is where laser would come in. So no matter what we would do with this patient with, Botox and skincare, we won't be able to address this tone and texture where she has a little bit of uneven skin tone, a little bit of bumpy skin texture. This can be improved with laser treatments. A few treatments of laser will make a huge difference in this. So I'm going to turn this over to Dolly, our nurse practitioner, who's going to explain how laser therapy works and why it's so important to do a combination treatment.
So the next thing you can do on top of Botox, fillers, Ulthera, and all the other modalities is taking your skincare to use laser therapy that can treat, as Dr. Lori mentioned, uneven skin texture, acne scars, fine wrinkles, dry eyes, laser hair removal, skin tightening. That's where laser comes in. A lot of us nowadays are on Zoom calls. We're seeing more of the fine lines. We're more focused on the uneven skin texture. And we want to know what's the latest and best technology out there right now and what laser can do to help with that. So on our next slide, the question is, how does laser therapy work? There's different types of laser. One of them is IPL. We have our YAG. We have Pico, all the type of different lasers that work at different wavelengths. Next slide. So light is going to hit at different wavelengths, which is going to affect our skin type and help improve the texture of it. And this is what's going to create the effect of resurfacing and helping to renew the skin cells, increase collagen production, and have that youthful skin brightening effect, as well as skin tightening. So some light waves that can target hair follicles will help with laser hair removal. That's one type of laser therapy. Other types of laser therapy is suited for, breaking up broken capillaries and spider veins. So if you can point in the next point, yes. And another type is targeting sun damage, age spots, and hyperpigmentation. Rosacea, that's another thing that can be treated with laser therapy. And light absorbs the laser by the skin and destroys that pigmentation. So it helps dissolve the hyperpigmentation, the age spots, sunspots, and helps improve that skin texture, making it look brighter, younger, more youthful, and also giving that tightening effect and generating more collagen in return. And renewing the skin, shedding the old skin cells, renewing the new skin cells. That's what we want. Tighter, brighter looking skin, more youthful, without having to go under the knife and do neck and facelift. Next slide. So as I mentioned, laser therapy can target 30 different types of skin concerns, and that includes the fine line and wrinkles, brown spots, age spots, hyperpigmentation, acne scars, rough, uneven skin texture, redness, rosacea, broken capillaries, leg veins, spider veins, and dry eyes. That's the latest and greatest technology that's out there right now that's created by Luminous. And that's our Stellar M22 laser therapy that just came out this year. And we're so glad to have it. And that's why we wanted to share this information with you. We love learning. We're very passionate about learning about what's the newest technology in aesthetics field. And so this is it. This is why we wanted to discuss and share this news with you. Next slide. This is going to show some of the results. For instance, skin rejuvenation, we can use IPL to help target those age spots around the neck décolleté and around the neck area. And this, you can see from the before and after picture, more youthful, tighter, brighter, and cleared after just only 2 treatments over 3 months. On average, it's going to take about 4 to 6 treatments for some people, and for others, it can take as little as 1 to 2 treatments where you can start seeing results. Next slide. And here, this is showing treating those age spots, the hyperpigmentation, the redness. If you look on the after picture, after 3 treatments within 1 month, 5 to 6 weeks apart between treatments, it's tighter, more youthful, brighter, redness is gone, and the age spots and sunspots have diminished. Next slide. Here we're showing the skin tightening effect. So after 3 months of 3 treatments, 1 month apart, you can see that not only did it help improve the skin brightening, but it also helped tighten that area, and there's more definition around that area. And she got rid of that spot, that's that dark hyperpigmentation spot that's at that corner of her shoulder right there. So that's what IPL can do. Another, on the next slide, we can also treat those age spots we get on the hand. When we're driving on the road, our hands are exposed on the steering wheel, and I already started having some of those age spots on my hand, which I know IPL is going to definitely improve so that it gives that more youthful look and more brightening and tightening effect, which is just after 1 treatment in that picture, you can get that effect on your hand. Next slide. And here we have our multi-YAG Q switch, which can be used to treat even skin types 5 and 6, so darker skin tone people as well as lighter skin tone. And it can help treat the sunspot, age spots, hyperpigmentation, and help with overall skin brightening effect. Next slide. We're using another picture, using it to treat brown spots and helping to line that skin texture, helping to, if you notice, also helping to improve that fine wrinkle, making that more softer. Her nasolabial wrinkle right there is softened up. And it also softened up her marionette lines at that corner right there, making it tighter and more youthful. And this is after 8 treatments, 1 week between. These treatments require very minimal downtime, so you can get back going at work versus if you did more invasive laser therapy, such as CO2, you can take a month recovery time, blistering, really scaly, peeling lizard-like skin texture. And it's hard to go out and work when you're doing that kind of invasive procedure. However, with this type of laser, very minimal downtime, very easy to be able to mix it with other treatments like Botox fillers and Ulthera or microneedling, chemical pills. You can combine that in 1 day and get everything treated and get your skin concerns within as little as 1 to 2 months. Next slide. So here we can use IPL to treat rosacea and dry eyes. If you notice the baseline, very red around the cheeks, the nose, the upper lips, but after just 1 treatment had given her the results of very clear brightening effect of the skin, less rosacea, less inflammation and flaring, because it's helping to change the vessels, decrease the vessel expansion that allows you to have that flare up in your skin. So it's really changing and tightening those vessels. And there's another picture right here helping to treat acne scars. So it's our RX Resurface, and it treats mild to moderate acne. After 6 treatments, 1 month apart, the texture is more smooth, more even, more brightening, and less of that deep pitted acne scar you see in the first picture. A lot of our patients come in with concerns about acne scar. This is the laser that can really revolutionize and change your skin tone and texture. Next slide. So here we have a patient. Concerns are the broken vessels all around the nose. We can treat it with IPL, 3 treatments, 3 months, 1 month apart after each treatment, minimal downtime, great results. And you can see it looks as if he was born like that without having to do much. And this is what's great about this new technology. You're not going to have, it's not going to be as painful. Numbing, we can do numbing right before the procedure. It's not going to take that long in the office. It's about 20, 30 minutes. And you can combine it with your microneedling or even have a facial that day and then get back to work on the same day. Next slide. So here is our multi-spot YAG treating leg veins. And that's very common for especially nurses like me. We have leg veins due to being on our feet for long periods of time. So if you have that issue, this laser is really good to help treat those leg veins. And after 4 to 6 treatments, you can see really, really good results. Next slide. So what to expect from our laser treatments? If you can put the first point down. So laser treatments, as I mentioned previously, just requires very minimal downtime. You can do it in between your lunch break, schedule appointment with us, and then just get back to work. Mild redness, you're gonna see some peeling, and make sure just to wear your sunblock and hat 1 week after post-treatment. And it's gonna take a recovery time, yeah, about a couple days to a week, but very minimally. You can really bounce back to your daily routine again. And the stronger laser treatments, like I mentioned about CO2, Pico, and some other lasers, it really damages the skin. So it can take a longer recovery time, a 1 month recovery time. And most people don't have that time. Most people don't have that time to, take 1 month off of work or not step out of that house for 1 month. So that's why I really like the Stellar M22. I don't have to take time off work because I'm a very busy person. And I want to be able to have like the best effect on my skin tone, but be able to not take so much time out of my schedule. Next point. So results, like I said, you got to be consistent. You got to make sure to come in for your treatments. And if that plan includes 4 to 6 treatments, make sure you come in 1 month apart and doing what we recommend, whether it's combining it with skincare products that's needed during the post-care instructions and combining it with other modalities like Ulthera or microneedling, Botox, and fillers. You can really, really get great results without having to go under the knife. So last point I wanted to mention is, there's going to be some mild discomfort, but like I said, we're going to be able to use topical numbing cream on you 30 minutes prior to the procedure to make it very comforting. So this is a procedure that's well tolerated with a wide range of patient population, as well as skin types. From skin type 1 to 6, we can treat all types of skin type with this laser because we have different types of laser that can target different Fitzpatrick scale. Last point here is that laser technology with this machine is more safer than previous laser technologies. And like I mentioned, it can be used with 1 through 6 Fitzpatrick skin type. And we can customize it and individualize it to your skin concerns and your skin type and ethnicity. Okay, next slide. So any questions for us so far? For me or Dr. Lori?
Yes, everyone. So thank you so much. This has been so much great information so far. This is the time you can put in any questions in the Q&A feature that you have. And we already have a couple that I'll start getting to right now. So let's see. Tell me about, do these laser treatments hurt?
So they're very comfortable and easily tolerated. It's not like lasers were 10 years ago. There is still some mild, tingling feeling. It isn't without any pain at all, but we do put some topical numbing medication that makes it very, very comfortable. It's not a very long treatment. It's about 15, 20 minutes for almost every treatment. Maybe the longest one is a little bit longer than that. And there's no pain afterwards. So just some mild discomfort during the treatment.
Got it. All right. How about, now everyone can see you a little bit bigger. All right. How about, can you use these lasers on all skin types? Is there anyone who can't get a laser treatment?
Well, you can use it, like I said, with Fitzpatrick skin type 1 to 6. We can customize it and individualize it to your skin concern and skin type. We have the YAG, which takes a wide range of skin types, all the way up to from African American to very light skin type, and we have our IPL. So we're gonna make sure we plan it accordingly to your skin type and ethnicity.
Great, that's helpful. And just want to remind everyone, after the Q&A, we will get to our giveaway and our special promotion for this webinar. So, all right, let's see here. You mentioned that this laser is safer than others. How is it safer? And are there any type of health conditions that might prevent someone from using the treatment?
This laser is a non-ablative laser. So compared to the more invasive lasers like CO2 and Fraxel, those are more ablative, which creates a really burning sensation. I've tried one treatment myself, and it took several weeks for me to recover just from Fraxel. And your skin feels very dry. It's very lizard-like texture, and it starts peeling like over several days, and you just look really scaly, like a snake just peeling off your skin. So I really didn't like that, and I think that was like the only one treatment I had. And whereas this one, it's much more gentler, it's non-ablative, so it's not as, you don't get as much of that burning sensation, but still getting really great results and with minimal recovery. So you can just get back to your daily routine again. Did you want to add anything to that, Dr. Lori?
No, that pretty much covers it. Like it is very tolerable and very short recovery time. Some of them have almost no recovery time. Some of these treatments are, same day. Nobody would even be able to tell that you had it within a couple of hours. Your redness has already gone down. Sorry, we're in downtown LA, so it is loud here.
That's okay, we understand. And yeah, that's why a lot of people call these lunchtime lasers, because especially the Stellar IPL that we are introducing today is a perfect lunchtime laser. You can come in and get it and go right back to work.
Yeah.
And in regards to that second question about, are there any medical conditions that can rule you out for laser? I would say at the moment, it could be pregnant or breastfeeding, as long as you clear it with your doctor and they're okay with you having this laser treatment. The studies haven't been done on people who are pregnant or breastfeeding. So I think that's one things that they add as like a contraindication. Other ones could be people who can't tolerate, people who have certain skin conditions, like they easily bruise, and if they get laser, they would blister really bad. If they bring this to our attention in the beginning and they're aware that they are able to tolerate it, we normally like to do a test spot. So we would do it like either here or here, and we would do a test spot and see and wait either 15 minutes to a day later just to see how your skin reacts to the laser. And then once it's safe, once we see that setting and that laser works with your skin, we're going to proceed with booking you for that first appointment for that laser treatment.
Got it. That's very reassuring. Thank you. All right. If you have acne breakouts, does that prevent you from getting the treatments?
No, we can, if you're having acute, active infected acne, that might be a reason not to get any treatments, where we don't want anything really manipulating your face. But that's very rare that somebody has bad acne infection. So anything that's already clearing up or that's being treated with topical medication would be able to tolerate it. If anything, the laser will help. Some of the IPL will help calm the acne. So you will have a little bit more inflammation for a few days, maybe more than somebody who doesn't have acne, but it will help you clear out an active episode of acne as long as there's not a bad infection.
Yeah, absolutely. I even know for myself, I've had acne and gotten it done, and it reduces the redness too. So sometimes it makes it look like you don't have as much acne anymore.
Exactly, yeah.
One thing I did want to add, for people who are on Accutane, we recommend that they complete the course of treatment before they start laser therapy, because with Accutane, it makes your skin very sensitive to sun and laser.
Yeah.
So those are the medical concerns I would say is a contraindication. When you're on Accutane, we would recommend you complete it before you start. And we recommend that if you're on any like retin A or retinoids, to stop the retin A or retinoids 1 to 2 weeks prior to the laser treatment.
Mhm.
Great. Okay. A few more questions. For mild skin concerns, mainly minimizing or shrinking the appearance of pores, not scarring, but pores, would you recommend IPL or microneedling?
I think it would be a combined approach. So in the past, we would, recommend microneedling only, but because the laser treatments had a lot of downtime just to address pores, but since they're really well tolerated, I would say you could do, stage it. So you do a microneedling treatment first, and then 2 weeks later, you'd have a laser treatment, and then maybe a month later, have another microneedling treatment. They're kind of targeting different depths of the skin. So they're both going to help with shrinking the pores, but in a different way.
Got it. Okay, here's another question. So I know we didn't talk about it on this webinar today, but I've read about IV therapy on your website. Can you give me the quick rundown?
Yeah, so IV therapy is another service we offer at our clinic, because a lot of times patients come in, especially due to the pandemic, they want their vitamin Z, zinc, they want to boost their immunity, or they want glutathione for their beauty shot, which helps skin brightening and lightening. And that's very popular in the Asian culture. So we offer glutathione, we offer weight loss injections. Those are some of the services we offer with IV therapy. A hangover bag after drinking, like after having like a long night of alcohol and drinking and partying. So that really helps with hydration. And we add Zofran to that, that helps with the nausea and vomiting.
And I guess, well, if someone does have a night out and they didn't know to schedule ahead, we accept walk-ins?
We do, in fact. We actually get a lot of walk-ins, and we get a lot of clients that are within our area that come and hear about us, from comedians to producers to, just daily people walking by who see our office and then wants to check it out and try it. And then we have a patient that consistently comes for a weight loss injection, and she's been seeing really great results, especially she wants to get ready for right before the holidays. New Year's Eve is coming up, so she comes once a week for her weight loss injections. We have consistent clients that come either like once a week or a couple times a month for their IV therapy.
Yeah, and we also have people, if you work in the downtown area, you could swing in real quick on a break or on lunch.
Yeah.
We have people all the time that pop in just for a quick Botox and then go right back like nothing ever happened.
Yeah, the nice thing is the IV can be done during their facial. So a lot of patients do that because then they're not wasting any time. They're already laying down for the facial. They're getting their 30, 40-minute IV drip, and then they're ready to go with it.
That sounds like the perfect self-care New Year's resolution to do those combined.
And it only takes about like 30, 45 minutes total. So it's a really quick one that you can do like during your lunchtime right before you get back to work.
Got it. Okay, can I get Botox, fillers, injectables, and an IPL on the same day?
Yes. So we would, just like any other of our deep resurfacing treatments, we would do the IPL first. And as long as there wasn't unusual reaction. Some people have very sensitive skin and they do swell a little bit more than others. Except for them, almost everybody tolerates IPL very well and could have their Botox for sure at the end of the appointment. Most fillers also can be done at the end of an IPL appointment.
That's very convenient too.
Yeah.
All right. Here's another great question. So I see a lot of people advertising IPL. How is the IPL that we now have different and better?
Dolly can answer this one.
Oh, different and better from what types of lasers?
From other types of IPLs.
Well, this laser is the newest laser offered by Luminous. So it's created in a way that allows minimal downtime. It allows just minimal discomfort, and we put topical numbing cream prior to the treatment. So you really will get that effect of getting your results without having to do so many. Previous IPL lasers, it can take more than 6 treatments, but with this IPL treatment, you can do it within 4 to 6 treatments, see great results, and then not have to come back for a time, for a long while, unless you have more acne scars later in the future, then you want to come back again for that. Yeah.
Got it. So not all IPLs are created equal. Just because someone says they have an IPL does not mean it's the same as the one we have.
Yeah, they're changing all the time, and there's a really big difference in the pain, the discomfort of the newest IPLs and the amount of downtime.
And I wanted to add, with this IPL treatment, especially, that they emphasize, they have this cooling effect. There's this thing that once it delivers the energy and the pulse, it gives you that cooling effect as well on top of that. So that's the reason why it's different from other IPL machines, due to that cooling effect that it delivers like about 5 seconds after the pulse.
Yes. So I will just say it. This is the best IPL on the market. It really is the top of the line. I mean, this would be the Rolls Royce of the IPL machines out there.
Yeah, Luminous is a very popular brand. If you look them up, they've been around for a very, very long time, and they created tons of lasers. And this is now one of the best out in the market. And I've been seeing it popping everywhere in like other Beverly Hills clinics as well.
Absolutely. All right. Just 2 more questions. I have heard of Ultherapy. Is there a difference between Ultherapy and Ulthera?
No, that is the same treatment.
Yeah, I know it can be kind of confusing, but technically Ulthera is the company name and Ultherapy is the product name. So yes, they are the same. And I know we didn't speak about them today. For those people listening that may not know what it is, do you guys want to give a quick rundown of what Ulthera is?
It's ultrasound energy, and it's delivered at different depths of your skin, deep in the skin to the dermis. So it's targeting different layers, and it helps with skin tightening. It helps with increasing collagen production, and it helps with overall the look. You just start to look several years younger. I've got a lot of people who, after just one treatment, their jawline is more tighter. Their face is more slimmer, especially in the Asian culture. They really like that slim looking V-shaped face. So always they come to me and they want to treat this area much more. They put in more energy here. And my patients have been getting really great results. After they get their treatment, they invite their mother, their friends, they tell them about that. So it's been, and especially the neck area, the saggy skin, people want to treat that area too. Ulthera helps treat with skin tightening effect from that. And it looks as if, for some people, it looks as if, they lost weight because of the skin tightening effect. But in reality, is your skin just, it's like electrocuting the skin cells just to tighten that. And it looks as if you lost some weight, but in fact, it's not decreasing your fat cells. It's actually really tightening that skin. So it looks as if you lost some weight.
Lifted, yeah.
Yeah, lifted.
It's amazing. So if anyone's like me and you stare at yourself on Zoom all day and you go like, Therapy could be for you. Okay, beautiful. Last question before we get to our giveaway. So is now a good time to get lasers? Should I be waiting till the summertime? When is the best time to get these lasers done?
Wintertime is the best time to get laser treatments. We want to have as little sun exposure or as long of a time since the last sun exposure in order to get the best results with less treatments. If you have more recent sun exposure, then you're going to have a lower setting of laser and a little bit slower of progress on your treatment plan. So it may take like 5 or 6 treatments or something that could have been done in 4 treatments. And so, and you want to be able to stay out of the sun after the laser treatment. So it's really, you know, this is the best time, especially for Southern California, to not ever without any sun, but at least it's a little bit less sunny, not last week, but you know, hopefully soon. And then, you know, with hat and sunscreen, this is the least amount of UV exposure you're going to get this time of year.
Yeah, so we call this laser season right now. Yeah. This is when everyone's getting lasers, especially to fresh up your look before the holidays.
Yep.
So, all right, well, without further ado, let's get to our great giveaway because it is laser season and it's the perfect time for you guys to take advantage of our brand new Stellar IPL from Luminous. We're really excited that everyone that tuned into this webinar, you are eligible for 20% off your first laser treatment or your first laser package. That's a huge savings, the most we've ever given. So please take advantage of that. You just need to secure everything before the end of the year. You don't need to necessarily get it before the end of the year, but we need to secure it. So if you mention this webinar, you'll get 20% off your first laser or laser package. And then secondly, we are going to pick one lucky winner who came on today to win 3 free IPLs, which is a $1,200 value. And I know whoever wins will be very happy with the results. So to just protect everyone's privacy for HIPAA, what I'd like to do is if in the Q&A or in the chat, if you could just drop your emails right now, that would be great. And we will go ahead and pick a winner and notify them tomorrow. And then as long as they're comfortable with it, we can announce it on social media. So if you guys could pop in your emails now, that would be great. And there's a way to send them anonymously if you want. Otherwise, if there's no more final questions, I just want to thank so much Dr. Lori and Dolly for all their education today. It's really wonderful learning about all this new amazing technology, and I'm really happy that everyone that's tuned in tonight can kind of be the first to know about all these great new lasers that we have.
Thank you.
Thank you.
So thank you all so much, and please come visit us. Oh, a lot of emails coming in, but please come visit us. There's so much we can do before the holiday time to help you look and feel your best. All right, thank you guys so much, and we look forward to seeing you soon. Bye.
Thanks.
Hey guys, have a good night.
Good night.